Hello my viewers and welcome back to the channel. So in today's video, I'm going to be telling you about 8 different medications which can increase your chances of getting dementia. It is important that you watch this video to the end, not just because of the dangerous side effect of this medication, but because you or someone you love might be taking these medications. Also, some of these medicines can be gotten over the counter, so it is very safe to say that a lot of people are abusing it, and that can be quite dangerous. So if this is something you would like to know about, please continue watching till the end and do not forget to share, like and subscribe to my channel. This will help me to be able to give out more of this information. So let's get started. So I'm going to be telling you about a class of medications called anticholinergics. So in geriatrics, which is a branch of medicine that deals with the care of the older adults, the use of this medication is usually cut down to its barest minimum because it has been found out that this medication slows down brain function. Also, it has been found out that this medication can cause Alzheimer's disease or other forms of dementia, and that it can also cause or worsen memory loss. However, despite this ugly side effect, the use of this medication continues to be widely used in medicine. So this makes me to help enlighten us, not just the elderly people, but the young ones among us, to know about these medicines, and if we have them prescribed, to have a kind discussion with our healthcare provider to know if we truly need them. So, what makes a medication to be an anticholinergic? Simply put, an anticholinergic medication is a medication which blocks or diminishes the effect of an important neurotransmitter known as acetylcholine. Now, this acetylcholine is a neurotransmitter, and a neurotransmitter, on the other hand, simply is a chemical compound which helps the nerve cells to communicate. Now, this acetylcholine is used greatly in the brain and also in other parts of the body. So in the brain, it helps us to think, to remember, and carry out other important cognitive functions. So you see how important this acetylcholine really is. These anticholinergic medications has other side effects like dry mouth, constipation, or even dry eyes. However, the most important and the most disturbing of them all is this effect on the brain. As I mentioned earlier, it can slow down brain function, it can worsen memory loss, and it has been linked to causing Alzheimer's disease and other forms of dementia. So what happens when people actually take anticholinergics? What simply happens is that it blocks this acetylcholine, which leads to decreased brain function, which a lot of people feel as sedation. And this explains the reason why a lot of people abuse this medication. Some of these medications are taken because it helps people to sleep. We have an example of Benadryl, that is diphenhydramine. It is an over-the-counter medication, and a lot of people abuse it. Though a little sedation may not be bad, but as the brain gets older, a continuous interference of acetylcholine by the intake of this medication can increase one's risk of developing dementia. Also, I forgot to mention that because it causes drowsiness, it also increases one's risk of falls. That is why sometimes when a patient, especially an older patient, falls, the doctors usually begin to review his or her medication to find out if there are medications which can predispose them to fall. And some of these anticholinergics has been found to cause that. At this point, I'm going to be telling you about the 8 different medications which are anticholinergic. So the first on the list is the PM version of over-the-counter painkillers. Example of this medication include the Advil PM, the Nyquil, and Tylenol PM. You might actually need to grab your pen and paper if you wish, so you can write them down, have more research on them before approaching your healthcare provider to have a discussion on this. Number 2 on the list is the sedating antihistamine. An example is what I have just mentioned earlier, and it is the Benadryl, that is diphenhydramine. The Benadryl simply is the brand name, but it can come in various brands. Number 3 on the list are medications used for overactive bladder. Examples of these medications are oxybutynin, tolterodine, and sulfenacin. So it is not completely out of place to use these medications, but it is important to have a good discussion with your healthcare provider, especially if you are expected to take this medication for an extended period of time or you're having signs of memory loss. Number 4 on the list are called muscle relaxants, and an example is called cyclobenzapine. They are usually used for neck pain or back pain. Number 5 on the list are medications used for itching, and an example is diphenhydramine and hydroxyzine. Regarding itching, it's good to find out the cause of the itching. In this case, if it's an elderly patient, most of the time they tend to itch a lot because of dry skin. So having a good skincare routine and using a lot of moisturizers can really help. Number 6 are medications used in the treatment of vertigo, motion sickness, and nausea. We have example of meclizine, which is used in the treatment of benign positional vertigo, and also dimenhydrinate, used in the treatment of motion sickness. Number 7 are nerve pain medications. In treating nerve pain medications, some tricyclic antidepressants are used. For instance, amitriptyline and nortriptyline. The last on the list is paroxetine. It is an SSRI antidepressant. It is quite cholinergic compared to other SSRI antidepressants. So SSRI simply means selective serotonin reuptake inhibitors. So geriatrics would rather prefer to use medications like citalopram, escitalopram, or sertraline instead of paroxetine. They try as much as possible to avoid the use of this medication, especially in older adults. So who should avoid anticholinergics? These are people who are trying to prevent the occurrence of memory loss in the future, people who already have dementia or Alzheimer's disease, and people who are at risk of developing dementia. That is the older adults. So you may be wondering, what are the long-term cognitive risks of taking anticholinergics? So in general, the long-term risks seem to be more related to the cumulative use and the dosage. So if you're taking it for a very long time, say for a number of years and at a very high dose, then it puts you at more risk of developing dementia. Just a little sedation or taking it for a few days may not necessarily cause any problem, but it is advised in general that for risky medications such as this, the general principle is for you to try to stop if possible, or switch to a safer option, or if possible, reduce to the lowest effective dose. So that is generally the advice for medications such as this. But if for any reason you are prescribed this medication for a long time, it is very important that you have a good discussion with your healthcare provider, because the truth is that some of these medications are things that you cannot do without in certain circumstances. So if your situation means that you have to take this medication for a long time, do not panic. Have a discussion with your general practitioner to see if there is a possibility that the dose could be reduced to the lowest effective dose possible. Because generally, if a medication, the taking of a risky medication, if its benefit outweighs the risk, it is generally advised that you continue taking such medication. So that is all I'm going to be talking about in this video. Do not forget to like, share, and subscribe to my channel if you found value for this. Thank you so much for watching, and bye for now.